Good morning, everyone. Today in parasitology, our topic of discussion is called as a parasite, which is called as Fasciola hepatica. So, what it is? It's a trematode. It is also called as it is also called as liver fluke. It is also called as fascioliasis, and it is also called as sheep liver fluke infection. So, Fasciola hepatica. It's a trematode. It's a trematode. Like as you know, last week we had done uh, trematode. Last week we had done schistosomiasis, right? So now this one, the disease which is called caused by this one is also called as fascioliasis, or it is also called as sheep liver fluke infection. The interesting thing about this one is what that before it was considered as veterinary problem or the diseases which affect the animals, but now uh, there is emerging cases, and it is it is now a significant human parasitic disease throughout the world. So which means like its distribution is worldwide. So it is believed right now, again, the statistics I am talking about are from WHO, that 17 million people around the world are infected, and another 180 million people are at risk of getting this one. So, as I told you, this one is worldwide distribution is there. Worldwide distribution is there. So, simply, the infections are found in Europe, in Central, in South America, in Middle East, in Asia. So you can say like these are all the regions which are affected by this one. And there are areas which are which have comparatively more infections than the rest of the world. Are basically Bolivia. Bolivia is in South America. Okay, Peru and Egypt and Iran. And basically, this one, the infection are more in the rural areas, or the rural areas have high disease burden. Uh, so now, one of the thing before it was believed that this condition is more common in the places where there is what you can say more livestock is there, but now they found that it is not the case. Simply, this infection can be in the places where which don't have much, you can say, livestock. Basically, you can say the cases are more in the population which are close to the intermediate host. Like what are the intermediate hosts? Of course, I will tell you now. Basically, they are the snails. So these are the few things uh, what you can say. Few facts about this condition. Like in France, what they found is like this disease is um, common in the people, or not common, like found in the people, you can say. In France, they uh, they found like uh, the people who consumes um, you can say contaminated watercress. Okay, they get infected by this one. In UK or United Kingdom, what they found, like UK, uh, they like cases are reported in the people who consume vegetables. Okay, when we'll discuss the life cycle, of course, you will get the answer of this thing. So now, by the way, most of the conditions nowadays they are not limited to certain areas. Rather, uh, they are more worldwide distribution, because as we know that there is more and more travel is around the world, and the people, they like communication or the traveling becomes so easy that by air you can reach from one place to other place so quickly. And that's why, when there was Ebola outbreak in Africa, so there were cases emerged in America. So, and simply like COVID-19, it spread worldwide very quickly. So the areas in which like this infection is endemic, like if you know the definition of endemic, simply where certain condition prevails, okay, or is present. So endemic regions, you can say, uh, children are commonly affected by this condition. So there is one study which tells like the children who consume alpha juice, they had this thing. This kind of infection is more in them. So anyhow, we are going to discuss like first like the parasite, how it looks like, and then we will talk about the mode of transmission, and then we will go like this one. So I told you already the other names of this one. Okay. Now, basically, this fluke or this trematode lives in the human biliary tract. That's why it is called as Fasciola hepatica. Hepatic means what? Uh, Liver, right? So, okay. Now, this one is the largest and the most common liver fluke, which is found in the man. And it have like the primary host is there, which is the sheep. Sheep is the primary host in these patients, right? In this parasite. So anyhow, how it looks like, simply I will show you this thing, like you can see over here. First of all, this one is large in size. Okay, and see, it's a trematode, it's a leaf shaped fluke, and this one is like around you can say 3 centimeter long and 1.5 centimeter broad, and the color is brownish, gray brownish color is there. So it have a oral sucker, you can see over here, and it have a what you can say, you can see over here, it have a uterus, it have a ventral sucker, it have an intestinal cecum, okay, it have testes, it have ovaries, so it's a hermaphrodite. Okay, it is a hermaphrodite, like all other tree modes, it's a hermaphrodite. And as we mentioned that this one lives in the biliary tract of the humans, and the life is around 5 years in sheep and 10 years is humans. So this is how it looks like. And the identification point of their its eggs, like this is the egg of Fasciola hepatica. So the eggs are large, they are ovoid in shape. Okay, and the egg basically contains, you can say, immature larva, which is called as miracidium. Okay, this one is present in this one. Now, when it comes to the life cycle um, of this one, we are going to discuss the life cycle of this one. And in the life cycle, guys, it have the definitive host, which is basically sheep and cattle to some extent. And there is an intermediate host, which is basically um, snails. And there is a specific type of snails which is called as limna. And now there is a plant which is called as okay. So this one is, you can say, the second intermediate host. And why? Because the encystment encystment occur on this one. Okay, encystment occur on this one. So again, like I will show you the diagram of CDC, which is like a good one. Okay, so here you can see snail, which is the first intermediate host, and the plants, which is the second intermediate host, and the human, the man, which is the definitive host, right? So this thing. So definitive host, of course, like we must add one more thing over here. I forget to mention this thing. Of course, like why we are studying this condition, so it should come here, man, right? So man, sheep, and cattle. So you can see like these are the definitive host, and this is the first intermediate host, and this one is the secondary intermediate host, right? Now, the important thing to talk about here is simply um, what you can say, what is the mode of transmission. So again, like you can see over here, like these are the infective stage. So this is the infective sign, right? And there is a diagnostic stage. So see, the microscope is over here. So see, when we like the humans, they pass them in their feces. The unembryonated eggs are passing feces. So we this is the diagnostic stage, and this one is like I told you that encystment occurs on the plants. So this one is the infective stage. So simply the human cycle starts when there is the encysted cyst, which is called as what? Metacercaria, okay, which is present on these aquatic plants, right? So simply when the man consumes this one, so either a man can consume it, or either the sheep or cattle can consume, right? I told you before, it was believed like this one, like this is a condition which affect the animals, but now they know, like not now, like of course for so many years they know that the man is also infected, right? So of course, like this metacercarias, they are attached with this one, this plant, and when the humans, they will not wash the vegetation and they consume, so they can have this metacercarias inside their GIT. So once it will enter the from the oral route, it can pass through the stomach and it will reach to the small bowel or small intestine. So in the small intestines, what happens? Like there is X cyst. What is X cyst? Simply, like the cyst will burst open and the larva will emerge or come out. Okay, so immature flukes exist in duodenum, penetrate into cell wall, and migrate through liver parenchyma to biliary ducts. So see, like in the humans, what is occurring is like there is accessment of this metacercarias. So now, once they are in duodenum or in small intestine, um, they travel through the lumen of the bowel, they penetrate into the peritoneum, and they enter into the liver capsule. Okay, so they enter into the liver capsule, or they enter into the liver parenchyma, in other words. So this is the stage when basically this larva, they become adult. You can see the adult one they are showing over here, adult flukes in hepatic biliary tract. And of course we are discussing Fasciola hepatica, not this one, gigantica. So gigantica means like the big one, right? So you can see like what I show you over here, this is the adult form. So this is the adult form, right? Same thing but black and white. So now what happens is like the larva, they mature into the adult in the liver, and they migrate to the biliary tract. Now when they migrate to the biliary tract, as we know that they are hermaphrodites, okay, so they started producing eggs. Now in the bile, those eggs can come into the GIT, and those eggs be can get exit from the in the form of feces, and you can see over here. Okay, so we can found these eggs in the feces, so that's why this is the diagnostic stage, right? So this is the stage where you can diagnose this condition, like the eggs are present in the feces. So simply, now the life cycle is like, of course, outside the man. See, when these fishes will reach to the fresh water, see here they had made the water, right? So what will happen? Simply the eggs are going to hatch in the fresh water, and here, see, the eggs become embryonated in water, and here they are going to release what? Miracidia. Okay, so Miracidia, they hatch from eggs, seek out snail, which is the intermediate host. So like these eggs are going to do what? They are going to infect the snail. Okay, and I told you the name of that particular snake, right? It is going to infect them, and this is the first intermediate host, you can say. Now this one get mature in the snail, okay, and they form this one, circaria. Okay, so basically this is the development in snail tissue. See, sporocyst, and this one is like circarias, right? Now, the snail can release the circarias in the fresh water. So, see, there are free living circaria in like in the water, okay, where they can attach to these plants. And what is this plant? This is called as watercress. Okay, like I told you, in France, they found like the people who consume this plant, which is watercress, they get infected by this one. And what will happen? The cycle will again join over here when the human are going to consume that. Again the process will start, right? So this is what you can say, the full cycle of this one, right? So sporocyst, like this is they are showing the development in snail. Sporocyst, and there is redia, radii. So redia, like there is redia 1, redia 2, but of course, like, no need to go into much detail. And what will happen? Circarias, they will be released, and they are going to attach to the plants. So that is what is needed simply in these patients, right? So this is how this you can say disease, or this parasite, it survives, right, in the humans. So now the important thing is that um, what are the clinical features. Okay, so of course, like when we will talk about the clinical features, uh, we are going to discuss like the like, of course, if you know the pathogenicity, what kind of damage it causes, so you can simply remember the clinical features, or you can write them to yourself if you had the concept, like how it is going to uh, present with, right? So basically, what happens is, um, it occurs in two stages. Okay, one is called as acute phase, one is called as chronic phase, or you can say one is the first stage or one is the second stage. So simply, there are two stages, and why they make it two stages? Because there is difference in the symptoms. Okay, difference in symptoms in both of the stages. That's why. So first of all, we are going to discuss the first stage, right? Or you can say the acute phase. So first stage of this condition, we are going to discuss that one. So basically, uh, when the parasite, it reaches the intestine, and it is going to penetrate the bowel wall and penetrate the liver parenchyma or the liver capsule. So uh, basically, this is the larval period, you can say. Okay, like this stage is basically due to the larval period. Okay, they have these signs and symptoms. So what happens, like the patient, they have abdominal pain. Okay, it presents with abdominal pain, fever, as well as weight loss and urticaria. So now remember, like guys, urticaria, what is this one? Like, there is hives and uh, allergies type of reaction on the body. Why? Remember, guys, that whenever there is any parasitic infection, what will happen is basically there is like the eosinophils. There will be eosinophilia. Eosinophils will be raised in the body. So remember, whenever there is parasitic infection, whenever there is allergies, eosinophils get raised. Okay, so simply eosinophilia where you can get on the labs of the patient. Of course, like it damages the liver cells, so the liver enzymes can be raised at this stage. Okay, so this stage is basically the stage when the organism have entered in the body, have is going through um, the intestinal volume and entering into the liver capsule. Of course, like then the patient have these symptoms. Okay, so there is penetration going on through the intestinal wall, and this stage can last for several months. And the egg production during this stage is very minimal. Uh, okay, and then there is second stage. So second stage, you can say this is the basically the biliary period or the maturation of larva. Okay, so this one is like you can say the mature larva period, right? Mature larva period, or you can say the biliary stage, like when it will enter into the biliary tract. Now like if you know what is the how the liver function and what is the function of the liver ducts, biliary ducts, so this larva, it lives in the biliary duct. So the symptoms of this stage are very very minor, or you can say very very of low intensity, or we use a word called as subtle. Okay, so subtle type of symptoms or signs will be there, or you can say the word vague symptoms, right? Like even symptom, you can say subtle or asymptomatic. So maybe the patient will be asymptomatic in these cases. Okay, now if there is symptoms, the patient may have right upper quadrant pain, or you can say that pain in the liver. And now this pain basically looks like the pain of cholecystitis. What is cholecystitis? Whenever there is inflammation of the biliary tract, we call it as cholecystitis. So of course, like at this stage, if you will do lab, eosinophilia will be present. Okay, and now this is a stage where you can say the ova released, and they can be found in the stools or in the feces, or you can say like this stage I'm talking about, like the eggs will be present in the feces, or this is the diagnostic stage as well. So most of the diagnosis is done in this stage, right? So this is how the patients present with. Now of course, like because like this one is present in the biliary tract, it can cause some complications as well. Okay, what complications it can cause is simply, you can say, uh, it's a chronic disease, so the patient may present with anemia, the patient may present with cholangitis. Okay, the patient may present with biliary tract obstruction, or you can say post-hepatic jaundice may be present, or there could be bleeding from the liver inside, so you can say there could be liver hematoma. Okay, or you can say there could be hemoperitoneum, which is what, bleeding inside the peritoneum. So uh, there are cases in which like this one enters into the lymph nodes or the brain or the skin or the eyes, but very, very, very rare. So you don't have to remember that, rather you have to remember this thing, right? So this is how we, you can say, this is how, what are the complications of this one. So other than this, like guys, I would like to talk about the diagnosis of this condition. Okay, of course, like the diagnosis is, first of all, it's always the clinical history, and then the examination, then we go for the diagnosis. So what are the symptoms will be there when what the patient will present with is with abdominal pain or fever, or you can say, for example, the patient may present with jaundice, or maybe the patient can present with some radiological abnormalities on the biliary tract. Okay, so one of the thing, as I told you, like one of the thing is eosinophilia, right? Simply, what is eosinophilia is, like I told you, whenever there is any parasitic infections or allergies, eosinophils get raised. So of course eosinophilia will point towards some sort of parasitic infection, right? So when we go for CBC, we will found eosinophilia. uh, Now, chronic stage, as I told you, that it could be asymptomatic, or the symptoms can be very subtle, like you don't know what's going on. So one of the things which can found on the labs is abnormal LFTs, okay, or abnormal liver function test. Now, what are the liver function tests? If you will open the diagnostic playlist, you can find a video over here about liver function tests. Now, we can found simply total bilirubin levels are raised, and we can found like AST is raised or ALT is raised, or you can say like AST is also called as, it is the abbreviation of aspartate transaminase, and ALT is basically alanine transaminases. Uh, okay, but of course, like the definitive diagnosis is, you can say, the stool examination for, or microscopy. Uh, okay, of course, like we at least look at the microscopy for the eggs, right? So when you are going to found the eggs in the feces, of course, like that will give the diagnosis. Uh, and of course, like it's not like this, like on one stool sample you can found the eggs. Sometimes you have to do multiple stool examination. Um, Previously they were using like indirect hemagglutinin test, okay, IST, but nowadays they don't use much. But you can say the test which is mostly used to confirm the diagnosis are ELISA. Okay, and simply what ELISA do is, like, it simply can detect fasciola, hepatica antigens in the blood, right? So this is like ELISA can do. So ELISA can be used simply to this one. Okay. Uh, uh, this is like the important test which you can do. Um, but there is some problem with the ELISA, like because many of the infections, there is cross reactivity with other parasitic infections. Okay, so like it could be positive, it can come positive when patient is not suffering from this one, rather with some other parasitic infection. Rest, like guys, we can do radiological examinations, okay, or radiological imagings, okay, and we can do anything, like you can say, um, CT scan can be done, or you can do what you can say, ultrasound can be done, okay. And of course, like whenever we do CT scan or ultrasound, they can found the changes. For example, maybe they will found thickening of the bile duct, or bile duct dilatation, or sometimes on ultrasound they can found mobile liver flukes, or these flukes which are mobile, you can say, roaming inside the biliary tract. Okay, they can found it easily. So of course, like these investigations are helpful in making sure or just cross checking your diagnosis, what you're thinking is right or wrong. Okay. Many of the patients, they do report liver abscesses, okay, because this one is lives in liver, so abscess can be formed, of course. And in that case, of course, we can go for a sample from there, right? So no, like there are other tests, which we can do in the liver. For example, we can do liver biopsy, we can do ERCP, like um, you can say that is endoscopic retrograde cholangiography, but they are not needed much for to diagnose these patients. Okay, so this is how we diagnose this condition. And the last thing, guys, okay, which is there is called as treatment, right? Treatment. Now, as far as the treatment is concerned, of course, we give antiparasitic drugs. For example, if you know, there is a drug called as albendazole. I already talked about that drug, albendazole, right? So there are different drugs, which comes, which are in that group. Is basically one is called as tri. Uh, it is called as triclabendazole. Okay, so triclabendazole. This drug um, is the first line treatment for this parasite, and it has basically sulfur oxide metabolite. You know, like this drug have sulfur oxide metabolites. Which when they act on the parasite, what happens? Like they inhibit the microtubule and protein synthesis in that parasite. So, so what will happen whenever we give this drug to the patients with this infection? What it do? It targets both. You can say both the immature and as well as the mature forms of the trematode or the larva, right? Trematode. Okay, so like this one targets the both the immature and the mature trematode. So this one is the best drug. Okay, and this one is like also listed in what you can say WHO drugs of essential medicine as well. Okay, so this is like the first line treatment, very very important. The good thing, like you don't have to remember the dosages, but if you want to know, guys, remember albendazole we always give in single dose. Okay, uh, and sometimes if a very severe type of infection is there, so uh, we can give like two dosages 12 hours apart, but mostly like it is given in single dose, right? So this is like how we treat this thing. And there are studies which says like you have to give two dosages of this drug, because what they found, like many people who did not clear all the parasites in with one dose, like when we will give the other dose, you can say the cure rate increases too much. um, there is one more drug which is not the first line drug. Remember, you have to remember just this one. This is some extra knowledge for you guys if you want to see, and of course you haven't started your pharmacology. So it is called as nita nitazoxanide. Okay, so this one is one of the drug which is also effective in few of the studies. Okay, and bithionol is also one of the drug which can cause uh, kill this parasite. Okay, uh, now one of the drug, guys, uh, what you can say, like in the previous in schistosomiasis and all this one, we talk about the drugs called as praziquantel. Okay, so praziquantel is effective against the fluke infections, but it is not effective against this one. So remember, triclabendazole is like the most effective one, right? in this one. And of course, like metronidazole or albendazole, um, they are also not effective against this one. So this thing is important now. Uh, Simply like we will give, or rather I should write over here, first line, drug, or the first choice drug, you can say. Very, very, very important. We are going to do this one. And the last thing which we always study about these infections is like how we can prevent and prophylaxis. What kind of prophylaxis can be given? Okay. So if you don't know what is prophylaxis, simply guys, prophylaxis is the medication which we give to any person to prevent something. For example, someone who is at risk of getting this condition, we will give them some medication which will protect the patient from this medication, from this type of what you can say, infection, right? So prophylaxis is that one. So regarding prevention and prophylaxis, of course, like early diagnosis is important, right? um, Now the problem with these conditions is what, like, if even if I'm working as a doctor, if the patient will come to me with abdominal pain and things like this, like I will not think about this condition, because this condition is not so common. So that's why I'm not going to think about this condition. So you can say like many of the cases can go undiagnosed simply because we don't think about this infection. So you can say that's why it is important to, if you are working in some endemic area where this is a public health problem, so always think about this thing. There should be some awareness campaign for early detection. So you can say awareness uh, for early detection, right? Should be given. So of course, like awareness in the health workers, in this case, right? So the health worker should be aware of like this condition is, how it present, and what you have to do. Uh, Other things, what you can say, which we can do to stop this condition. One of the thing, we can control the intermediate host, or we can control the secondary intermediate host. So of course, like improving sanitation is very, very, very important. Okay, because see, the human can infect the fresh water by their feces, so contaminate them. So improving sanitation is very important. And of course, like you can say, improvement or inspection of you can say the vegetables, right, or the vegetations uh, should be done. Improvement. So improvement or inspection of the, oh, I forget the thing. Is again one of the things which we can do in these patients, right, to avoid this infection. Other than this, what can be done? Like, of course, food should be properly washed and cooked. Okay, of course, like that prevent a lot of diseases. And of course, like nowadays, when the sanitation is becoming good, so of course, like these things are getting better. Okay, so that's the thing. uh, and one of the thing, they started thinking about, what you can say, controlling the snail. Okay, is also one of the way to control that. But simply, like, these are all the things which we can do to prevent and for prophylaxis. Okay, so that's uh, that's all, I think, guys, about Fasciola hepatica. Not so difficult. I will see you in the next lecture. Thank you for listening.